The Guam Behavioral Health and Wellness Center's annual GoPeace Conference, empowering important conversations on suicide and substance abuse prevention, earlier this week at the Dusitani Guam Resort in Tumon. One of the key topics was transformative prevention, adapting strategies in a shifting cultural landscape. With the rising dangers of illicit fentanyl, panelist Audrey Beneventi with Jibwick's Project Path points out it requires, quote, radical ideas like offering free Narcan and vending machines, and debunks the misconception that it might encourage opioid use.
One, naloxone, there's no abuse potential for it, so you can't abuse naloxone. Two, providing something like that, a life-saving medication, really doesn't encourage people to use it because it gives really uncomfortable withdrawal symptoms when someone is overdosing on opioids.
She adds the agency is seeing a gradual increase in high school youth taking medication without a doctor's prescription, a concern with fake pills being laced with fentanyl.
But we have to be, when we think about opioids, and I don't want to get so technical here, but there's so many different aspects of it, right? We're seeing it, opioids is a prescribed medication, so you can get that right from your doctor for pain.
Where do you find opioids? I'm sorry.
No, it's okay. So opioids is usually prescribed for pain, right? So you can get it from your doctor.
What are some of the names?
Like hydrocodone, there's morphine, so that's the usually prescribed opioids. But then what's so dangerous is that you're seeing the illicit part of it. You're seeing fentanyl, right? And that's the fake pills that are coming in that people might be accidentally overdosing. So that's why it's just so important, because you have individuals who might take something that they don't know is laced with fentanyl, right? Or they're not intending to take it. But then having naloxone on hand gives them that life-saving measure in case of anything happens.
For panelist Via Defon, a publicist with the University of Guam Press, continued candid conversations are important for the community-based publisher.
A creative writing workshop centered around Dry Nights with a really talented group of students at George Washington High School. And when it came to the discussion portion, one of the students had mentioned that, I do want access to these resources, especially about mental health and suicide awareness, but he expressed that he was afraid that if he had brought it up to his mom, that it would cause this unnecessary worry.
But it doesn't have to be a difficult or heavy conversation. As founder of Ina Wallfest, Livia Marati puts it, mental health can be a celebration.
Some of the most popular breakout sessions within the event are the creative ones, right? Where people want to go paint and they want to do vision boards and they want to, express themselves. And so just knowing that health can be fitness, it can be yoga, it can be meditation, but it can also be art, it can also be music, it can also be creative expression, and allowing it to just speak for itself sometimes, right? Rather than have it be so we're going to have a conversation about mental health, right? Allow the whole experience to be mental health prevention too.